Hello dear aspirants, welcome back to your channel Nursing Concepts by Raghav. So firstly, I'll congratulate all the dear aspirants who have qualified for the NORCET mains exams, and I wish all the best for your NORCET mains, and even I wish the better luck next time for the candidates who failed to reach the mains. So the candidates who have failed to reach the mains, don't feel bad. Okay, consider it as an experience. So it helps you to identify your weakness and the strengths and the mistakes that you have made in the exams. So learn from your mistakes. Don't try to come up with the new strategies so that you never repeat these mistakes in the upcoming exams. Okay, so with these words, so let's start the today's session. So today I am going to discuss a very important topic for the NORCET and for the all upcoming competitive exams. So definitely you can consider one or the two questions from this today's topic, that is ABG, arterial blood gas analysis. Okay, so without wasting much time, so let's start with the today's session, that is on ABG. If you are watching for the first time or if you are visited for the first time to my channel, please do subscribe and watch the video till the end. तो चलिए आज के वीडियो शुरू करते हैं. ABG. The ABG stands for what? Arterial blood gas. A stands for arterial blood gas. See, this is ABG, arterial blood gas. So the name itself indicates arterial blood. So means here the sample or the blood what we take is the artery. So this is very important. You must remember this. So which sample we will take? We will take blood from the artery. Okay. So that is why it is arterial blood gas. So what we usually assess in this? We assess for the gas. So what are the major gases in the blood? That is oxygen and the carbon dioxide. So this ABG, why the ABG? Why we do take an arterial blood for the gas analysis? So it will help you to assess the respiratory functioning. So as we are going to identify the values of the oxygen, carbon dioxide, and even the pH. So this will help you to identify the respirator status, the metabolic status, and the acid base balance in the body. Okay, so three major components we commonly assess in the, that is oxygen, carbon dioxide, and pH, and thereby we will identify the respiratory function or the metabolic functioning and even the acid base balance of the in the body or in the blood. So this is what we call it as a arterial blood gas. So why the blood from the artery to analyze the gas? So that question might come. Okay, or you may think, why do we need to take the a sample from the arteries? The arteries, so arteries are rich with the oxygen. Okay, so this will help you to identify the respiratory function, how well the lungs are capable of, or the how well the oxygen is being transferred into the blood and taken to the tissues. Okay, and similar way, how well the carbon dioxide is being taken from the blood and then to the lungs for the expiration. So this majorly the internal respiration, we call it as a internal respiration. So how it is being taking place, and oxygen is required, and the carbon dioxide is an it's an end product of the metabolic activity of the cell, so it has to be removed off. So if it is retained, what happens? Okay, if the oxygen is not being supplied to the tissues or the cells, what happens? So it will make a problem with the cellular function or the metabolic functioning in the cell. So by assessing the oxygen level and the carbon dioxide level and even the pH, we can directly assess the respiratory function and metabolic function and the acid base balance in the body. So this is why do we need to take the blood from the artery to analyze the gases? Why not from the venous? Okay, so this is I think you understood why the arterial blood for the gas analysis. So what are the sites, common sites where we take the arterial blood sample? So the most commonly or the most common or the first prior the sample we take from the radial artery. This is very important. Okay, so this is very important. Radial artery, so where it is, what is the site for radial artery? Okay, at the thumb side of the your wrist, so that is a radial pulse. Okay, where you assess the radial pulse, so this is the site for the radial artery. We commonly take the arterial sample from this artery. This is the first priority. Okay, there were other sites also, so this is considered to be the most common and first priority or the first preferred site for taking the arterial sample. Most common, first priority and most preferred site for the arterial sample. Then location you understood. What is the angle of insertion? When we take the sample from the arteries, what is the angle of insertion? So we should insert the needle at an 45-degree angle to the skin surface. Okay, so to the skin surface, so 45-degree angle should be there while to draw the blood from the radial artery. So before here, one thing we should remember about this, when you are taking the radial artery blood, that is for the ABG, so we should do the Allen test before we consider this artery for taking the blood sample. So we'll discuss this. What is Allen test? Allen test is usually used to assess the collateral circulation, okay, or it is used to assess the patency of the ulnar artery. Used to assess patency of ulnar artery. Okay, this is very important. So you may get a question on this also. Allen test is done for what? Allen test is done for assessing the patency of the ulnar artery, not the radial artery. Okay, because we are puncturing the radial artery, so we should understand, we should know whether the ulnar artery is patent, so that it will have the hand or the palm will have a proper blood supply. Then the second most common artery is the brachial artery. Okay, so what is this? Where is the site? Medial to the biceps. Okay, so here we can assess the brachial pulse. Okay, or the brachial artery. So when you consider this artery, the angle of insertion will be 60 to 90-degree angle, and this is the second priority, so which is quite deeper as compared to the radial artery. And the third one is the femoral. So in the groin region you can have the site, okay, where the femoral artery is present, and the angle of insertion will be 90-degree. So this is used only in the case of emergency, not as a routine for ABG analysis. We usually use the radial artery. This will be considered last. Okay, so the last option for first is the radial, then brachial, then femoral, then the femoral. So because so there is a risk of complications like especially the hematoma. Okay, what complication might occur? That is hematoma. Okay, once you puncture, there is a chance of bleeding because this is a bigger artery, so there is a chance of heavy bleeding can occur. And as this is near to the perineum, so there is a possibility of infection is also more for the femoral arterial blood sampling. Okay, so because of this is considered to be in the as a last option. Okay, in the case of emergency it can be used, but routinely the most preferred is the radial artery. And in the case of newborn, we commonly use the umbilical vein at the umbilical side for the newborn. Why the vein here? Why not the umbilical artery? See, as you all know, the umbilical vein carries the oxygenated blood. Okay, so arteries always carries the oxygenated blood. So this is an exceptional vein where it carries the oxygenated blood. So these are the common sites for taking the ABG sampling. So what some points you should remember about ABG sampling. What syringe we use? Okay, so we commonly use the 2 cc syringe with the 23 needle gauge. Okay, so that is a blue color one. So 23 needle is a blue color one. Okay, blue color needle, and that is 23 gauge needle we will use. Then syringe should be heparinized. This is very important. So syringe should be heparinized with the unfractionated heparin. So because in the routine for the routine blood investigation, we take the venous blood and we'll take it in the vacuum okay, or in the containers, and then we will send it to the lab. So but here what happens, we draw the blood in the syringe. That same syringe will be sent to the lab for the reporting. So to prevent the clotting, we should heparinize the syringe with the unfractionated heparin to prevent the clotting. So what do you mean by this heparinization? So we don't take any of the heparin into the syringe. So we will take the heparin and then flush it back into the vial. Okay. So it is just like surfacing the barrel of the syringe with the heparin. Okay. So excessive heparin should not be there because it may alter the values in the blood sample. Then is it anesthesia is required or not while taking the while pricking the artery? So in some patients it may require, or some hospitals may recommend. Okay, there might be a protocol in some hospitals. They may recommend like local anesthesia is given before we prick the arteries. So, but routinely it's not being done in the hospital setup. Okay, in the hospital, many hospitals they don't follow this, giving local, or they won't consider giving the local anesthesia for the ABG sampling. So once you draw the blood, how will you identify that? Because the how will you identify whether it is an arterial or the venous blood? So because sometimes what happens, because the arteries and veins are side by side, so sometimes when you prick, or when you insert the needle, your needle may prick the venous and you feel that you have pricked the artery and you will draw the sample. So you have, instead of artery you have taken the venous sample. So how will you identify that whether you have taken the arterial sample or the venous blood sample? So just by color, by noting the color, we can differentiate whether it is an arterial or the venous. So usually arterial blood will be bright red in color, and as the arteries are having the more pressure, so as your needle pricks the arteries, the blood will easily comes out. Okay, with the high pressure, so the blood easily comes up in your syringe. So with the high pressure, the blood will come. So if it is a venous, the blood will be dark red, and we have to draw it because there is a low pressure. So we have to draw the blood with the in the syringe. So this is the two factors. One is the color and with the pressure. So bright red means it is arterial, and dark red means it is venous blood. So now we will see about the Allen test. I told before we draw the sample from the radial artery, so we have to do the Allen test. So that is a modified Allen test we have to do. So this test will help you to identify the patency of, I told you to check the patency of ulnar artery. So you may get confused. We are taking the sample from the radial artery. Why do we need to check the patency of ulnar artery? See, your palm is having the collateral circulation from the radial and the ulnar arteries. Okay. So when you are pricking the radial artery, so make sure that your palm should get a proper circulation from the ulnar artery. So if it is patent, then your palm will get a proper blood supply. So if there is a blockage or any damage to this ulnar artery, and you more on that you are pricking or you are puncturing the radial artery means the blood supply may hamper to your palm area. So in order to prevent this, so make sure that your your ulnar artery is patent and there is an proper or the collateral circulation is from the ulnar artery. So to check that, we do the test called as Allen test. So it is a modified Allen test. So original Allen test where we do check the both the hands together, but here in the modified Allen test we do check the patency of ulnar artery in the each hand. So that is what the difference between the original and the modified Allen test. So how this modified Allen test is done? So here first we have to ask the patient to clench his fist. Okay, so first we have to clench it. Then the healthcare provider or the examiner will occlude both the radial and the ulnar arteries. Okay, with the firm pressure, he will put a pressure over the radial as well as the ulnar artery. Then allow the patient to open up his fist. Okay, so it will be pale or blanched because of the blockage of these both the arteries. Okay, there is impairment in the blood supply, so your palm or the patient's palm will get blanched or there is a paleness. Okay, so then what you have to do is we have to keep the pressure over the radial artery like that same, then release the pressure over the ulnar arteries. So within 5 to 15 seconds, so if the palm turns to a pinkish in color, so that means the blood supply or the blood is being supplied or released from the artery. Okay, that is ulnar artery. So your palm will turns to pinkish in color within 5 to 15 seconds. So this is considered to be the positive or the normal Allen test. So that indicates there is a proper or good collateral circulation from the ulnar artery. So this is how do we do the Allen test. Okay, so similarly this can also be done in the same hand, but this time we can release the pressure over the radial artery to check the patency of the radial artery as well. So but this is not commonly being done in the, as I have told, Allen test is majorly done to identify the or to know the patency of the ulnar artery. So that is, if you release the pressure over the ulnar artery, if the palm turns to pink, then it is a positive test. Okay, so this is the test that we do before considering the radial artery puncture. Okay, before we take the sample from the radial artery, we do the test Allen or modified Allen test. So this is very important. You may get a question on this test also. So which test we do before ABG from the radial artery? Okay, so here is a picture. See here how it is been done. First it will be made fist, then both the arteries, that is radial and the ulnar arteries, have been blocked. We have to release the pressure over the the ulnar artery. So your hand turns to pink, then it is positive. If it doesn't turns to pink, then negative. So if it is positive, then means it's a normal. If it doesn't turns to pink, then what we have to do? So in that cases, we have to avoid pricking the. So in the case of a negative, so positive means it is a normal, okay, or it is a normal where we can go with the radial artery, radial blood sampling. So if it is a negative, negative means where your hands will not turns to pink, okay. So then we should avoid radial puncture. Radial puncture, then consider the other arteries. Consider other artery. So you may consider the brachial artery or you may consider the femoral artery for the sampling. Okay, so this is very important. So there is a possibility of getting question on this Allen test. Okay, so after the procedure, okay, so what we will do in the procedure? So in the procedure, first we will take a syringe. Okay, so syringe is like a 2 ml syringe with the 23 gauge needle. That syringe will be heparinized. Then for taking the sample, first we have to locate the radial artery, okay, that is a pulse. So before we go for a pricking, so do the Allen test. Then for taking the sample, make an extension of the wrist, okay, so we have to make extension of the wrist so that we can easily locate the pulse or the radial artery. So by extending the wrist, we can easily locate the artery. Then insert the needle or insert the needle at an 45-degree angle, take out the sample, and after taking the sample, immediately it is to be sent to the lab with the ice pack. This is very important. After taking sample, after sampling, so send to the lab, send to lab with the ice pack. Okay, so here I have written it. Immediately we have to send with the ice pack. So if you keep it longer in the okay, if you make a delay in sending to the lab, so there is a possibility of variation in the lab values. So it is to be sent with the ice pack to maintain the normal, that is temperature should be maintained by of the blood. Then after drawing the blood, we should apply pressure over the site. This is very important because you have pricked the artery is having the more pressure. If you leave like that, then there is a oozing of the blood can occur, and there is a formation of hematoma will be there at the site. So to prevent that, we should apply a firm pressure over the site at least 5 minutes. Okay, in the case of normal patients, 5 minutes. And if the patient is on anticoagulant therapy like heparin or the aspirin, okay, so in such patients, minimum of 10 to 15 minutes pressure should be applied over the site. So this is important. You must remember these things. 5 minutes pressure in a normal patient, 10 to 15 minutes pressure in a patient who is on anticoagulant therapy. Okay, so these are the some important points you must remember about the ABG, arterial blood gas, the common sites. Then another important thing is so what is the best way to assess the effectiveness of oxygen therapy, so that is ABG. Okay, so ABG is a best way or best indicator for the effect to assess the effectiveness of the oxygen therapy. So if the patient is on oxygen therapy, or if the patient is on a non-invasive ventilation, or if the patient is on the a mechanical ventilator, so how the whether this oxygen therapy is effective with the patient or not, that can be easily assessed by noting the ABG, because it will identify the value of the carbon dioxide, value of the oxygen, and even the pH. So and even the bicarbs are also been noted in the ABG. So that is why it is considered to be the best way to assess the oxygen therapy. So in the ABG, what things we will see? So what are the values we will see in the ABG? So that is a pH, where the normal value is 7.35 to 7.45, and we will check the partial pressure of the oxygen. So it varies between the 80 to 100, and normal PaCO2, that is partial pressure of the carbon dioxide, 35 to 45, and bicarbonates, that is 22 to 26 millimoles per liter. Then base excess, okay, base excess, that is -2 to +2. Then oxygen saturation, then that is 94, more than 95 percentage. So this is also very important chart. You should remember the normal values of the ABG. So what is the normal value of pH? They may ask you what is the normal value of the partial carbon dioxide, okay, partial pressure of the carbon dioxide, or the partial pressure of oxygen. So this is very, very important. So in that, most frequently asked question on the this thing is the normal pH of the blood. So this is the normal pH of the blood, that is 7.35 to 7.45. So we will discuss what happens when there is an abnormality with these readings. Okay, what happens if the pH level goes less than 7.35? Okay, if it goes more than 7.45, what we consider if the values of this PCO2 is less or more. Okay, so that is all we call it as an ABG interpretation. Okay, so in the another video we will discuss related to this ABG interpretation, how to interpret the data or the values of the ABG, and how to identify the acid base imbalances based on the ABG values, that we will discuss in the next video. So this is all about the today's ABG concept. So in the next class we will discuss the other or the remaining part of ABG. Okay, so hope you all understood the today's concept. We'll see you in the next video. Please do subscribe to my channel and press on the bell icon so that you will receive my next video notification. So till then, take care and keep studying. Thank you.